There could be new requirement changes for Medicaid programs and recipients.
A bill proposed by U.S. House Republicans would change the eligibility requirements for those covered by Medicaid expansion under the Affordable Care Act. Brianna Fallon joins us in the studio with more details. Brianna, what can you tell us about all of this?
Yeah, Dana and Janet. So if this new bill is passed and signed into law, there would be a new stricter requirements for enrollment. One Virginia resident we spoke with says he's concerned about the potential changes. Andrew Daughtry is one of more than 600,000 Virginians who rely on Medicaid expansion. But now he's worried about losing his health insurance.
Don't make it harder for people to get Medicaid. Please don't make it harder to stay on Medicaid.
Newly proposed legislation by U.S. House Republicans could further restrict access to Medicaid expansion. If passed, the bill would require most non-disabled adults under the age of 65 to work, attend school, or volunteer for at least 80 hours per month. The proposed bill would also require adults covered by Medicaid expansion to prove their eligibility every 6 months. Daughtry used to work in construction, but ever since he says he was injured while working, he's been out of a job.
Please don't question our work ethic because that is insulting.
Daughtry says he needs Medicaid so he can afford care and eventually get back to work. But not only could the proposed bill impact people such as Daughtry who rely on Medicaid, medical providers say it could also affect local hospitals.
Hospitals will close when you don't have people with reliable health insurance.
In addition, if this bill does pass, Dr. Jessica Lazaroff, who practices in Virginia, says when it comes down to it, this proposal could hurt the people who need help the most.
But we're talking about families, like it's been mentioned, who may be needing to choose between paying for food or paying for rent. Copays are a big deal, and we should be talking about how to make healthcare more affordable for everyone and not more expensive for those who can afford it the least.
And according to the Congressional Budget Office's preliminary estimates, if this bill passes, the number of people without health insurance across the U.S. could increase by at least 7.6 million by 2034. Brianna Fallon, 13 News Now.
All right, thanks, Brianna. And the Congressional Budget Office preliminary estimates show Medicaid provisions would decrease the federal deficit by more than $600 billion over the course of 10 years.